Okay, the Showcase of Advanced Health and Medicine Research Clusters Symposium. On behalf of the organizer, we wish to extend our warm welcome and thank you to all professors, doctors, and participants. Okay, so we have 10 presentation today. Okay, it's all about the scope, the introduction, and also the research activities of the research cluster. Okay, so without further delay, I would like to read a bit short biography of the first group, the Vision and Eye Research Group, okay, headed by the Associate Professor Dr. Wan Haslina Wan Abdul Halim. Dr. Wan Haslina is a consultant ophthalmologist in a hospital for Glaucoma at Dispenser, Malaysia, specializing in cornea and anterior segment. She received ophthalmology training from National University of Malaysia in 2008 and pursued a doctorate degree in visual science from the Birmingham, United Kingdom. She was appointed as a British Contact Lens Association of Fellow in 2014, and she then successfully graduated with a PhD in 2017. Her doctorate research was a corneal biomechanics assessment and its effect on photometry study in a normal glaucoma as well as a keratoconus population. So without further ado, I will like to invite Professor Dr. Wan Haslina Wan Abdul to present his group research.
Assalamualaikum warahmatullahi wabarakatuh, and very good morning to everybody. Oh, I'm sorry, there's a pop-up here. So, okay. I would first thank the chairperson for the gracious introduction. And let me first begin the session with the introduction of Eye and Vision Research Group in the Ophthalmology Department, UKM, sorry. So Ophthalmology Department, UKM, started in 1977, the day I was born. So it is founded by one of our pioneer, which is Dr. Haji Muhammad Normal Hakim, in which we still dedicate one seminar room in his name. And we have produced more than 300, I think latest will be about 400 plus eye specialists around Malaysia or all over Malaysia. And our team consists of 15 lecturers and 14 lecturers and also training lecturer. And we have optometrists with us, we have research officers, medical lab technologists, and also support staff. So people say tak kenal maka tak cinta, right? So this is to introduce our faculty members. We have glaucoma consultant, two glaucoma consultant in our team, which is Prof. Shamsia, Prof. Jemaimah, and others each have one consultant in charge. One is pediatric ophthalmology, Dr. Safinas, vitreal retina unit, Professor Melin, me as a cornea and anterior segment in unit, and also Dr. Uthmaliza in oculoplastic. There are the other lecturers and junior lecturers are in specializing in general ophthalmology. So what is our clinical setting? Just to give you an overview, what do we have in our department that makes us able to perform our research activities? Yeah. So we have we offer outpatient services where the eye clinic, which is our outpatient clinic, is located in the first floor of the hospital building and capable of sitting at one time 160 patients. Actually, we do have more than 160 patients in a day, but there are extra sittings, and we have staggered timing slots to make sure that there's not too many patients at one time. So we also have our ophthalmology ward located in the 5th floor with a bed capacity of 28. But I think now we have expanded our service in terms of servicing patient who has day daycare appointment, and we have now a daycare ophthalmology ward located just beside the ophthalmology ward. And in terms of operation or surgeries, we have 2 operating theatre which sees more than 1,000 eye operations per year. And this is not only doing cataracts, but also subspecialized surgeries such as cornea transplants and glaucoma drainage device implants, and etc. So our clinical setting has enabled us to perform clinical research, not only with clinical outcome, but more also on visual related research setting. So this is just a picture to just introduce you the situation in our clinic. You see there's a large crowd there, but these are the sources of how would I say, subjects and volunteers for our research. And we do have optometry service and also all the other visual diagnostics devices. For your information, our eye clinic is very much equipped with most up-to-date facilities. We have spectrodome in OCT, and I think we have the latest OCT machine since then. We have retinal tomography and angiography device, and we also have the latest laser machine to make sure that our service is up-to-date and also able to service the patient better. And we have confocal microscope, electrophysiology equipment. We have also all corneal diagnostic devices such as Pentacam, Keratograph 5, and Corbis ST. And these are looking into more advanced diagnosis of corneal problems. So in terms of operating theatre, we have 2 operating theatre with latest phacoemulsification and vitrectomy machine. We always make sure that our instruments are all up to date. And if there is any problem, we have the cooperation of the industry to make sure that we give optimized service, surgical service. And we have other additional machines such as endoscopic cyclophotocoagulation machine, indirect laser machinery, which may not be able in other hospitals, but it is available in our setting. So just to give you a brief view of what we are servicing, not only we are doing clinical service, but we are also servicing in terms of training eye specialists, ophthalmologists. So what we do is we train them for 4 years. It's either in campus or out campus. So from here, we have, I would say, a very large source of research student. Okay, so every year we have about 15 to 20 intakes, and from these students are being supervised in terms of their research, because at the end of their 4th year they are obliged to submit their research dissertation in order to pass their ophthalmology training. So just to lay out the members of the research group. The research group is consisting of not only the ophthalmology department lecturers, but it also consists of allied members. So other allied members, mostly from the faculty, and we have here from engineering faculty, and Dr. Mimi, Dr. Kalaivani Chalapan is from engineering. I'm sorry if I missed some, but these are the key co-researchers that are working very much close to us in terms of making sure that our research is a success. So Prof. Dr. Nuzana from anatomy, Professor Angela from CETM, and Professor Muhammad Fauzi as well, and Dr. Idayu from JKM, and of course Prof. Nur Azian from UMBI. So I'm sorry if I don't mention all the allied health members, but we also do cross-department research. So we do have collaborators from other departments in our medical faculty, and Alhamdulillah, the quality of research has risen up very remarkably since we do collaboration with our allied allied members. Yeah. So, well, our research group is largely divided into one experimental, clinical, and epidemiological. But we also have one more, which is an animal study. So the animal study is being performed in our department, mostly on conjunctival, cornea, and retina areas. Yeah? So the experimental study is being done where there is genetic study, tissue engineering research, and also stem cell research. We also have clinical study where we do drug trials, and we do randomized control trials, not only on insulin eye drop, but also on umbilical cord blood serum. Okay, and we also do many clinical trials that testing drugs use in the eye. So the epidemiological study that we do is not only case control and cross-sectional, we also do a large-scale population-based study. So at the moment, the collaboration is more with other centers such as optometry unit, optometry faculty, and faculty of science, science health, and in terms of clinical trial in animal study, we do both mainly in-house, which is between collaboration between ophthalmology department as well as CITEM, the tissue engineering center. So what laboratory that we worked with? So as I said just now, we do work together with UMBI on genomic, biobank, metabolics, and proteomics, and with tissue engineering center in terms of cell culture, stem cell study, animal biobubble, and also in vivo imaging. Then we also work very closely with Faculty of Engineering, UKM, but I think we also work quite closely. We have worked before with engineering department from GMI, German Malaysian Institute, and other center. So we look at medical devices, cardiovascular, ocular, vascular engineering, and also health management. So just to recap a bit about our stem cell research. So far we have a very nice team where each of these lecturers look at different areas. And Prof. Jemima is actually leading in terms of conjunctival stem cell study, regeneration and stem cell study. And I'm more to cornea regeneration and limbal stem cell research. So we do have create animal model with limbal stem cell disease, and at the moment there are, I think, about 2 or 3 industry that are interested to test their drugs on our limbal stem cell model. So the other one is optic nerve and retina, led by Prof. Maylin, where she looked at simulated models of injury on the retina and how to treat them. Okay, so from our study and research, we actually come up with many on innovation. I would say that some of them is still in TRF 4, 5, and some is actually 6 and 7. So to help the blind to read is also one of the innovation that was initiated by Professor Mosha Wiati, who sadly left us, retired, sorry, so already retired, and Smart Medicine Dispenser system, where we are looking at easing the patient in terms of storing their and making sure that they adhere to their eye drop and medication. So other than that, we also have virtual reality cataract surgery simulation product, where we are looking into the future of industrial revolution, where we want to train our student first with virtual reality simulation before they ever touch patient's eye. So this will enhance their ability to able to do surgery better and reduce the outcome or reduce and unfavorable outcome or complication. So the other one is synthetic eye model for cataract surgery training. So we are looking at improving teaching and learning in terms of cataract surgery by also making an eye model. So before this, what we do is we get organic eye, such as a goat's eye or a cow's eye to do training on. But now we are innovating in terms of making a synthetic eye model so that we can also improve the way we teach cataract surgery for our trainees. Other than that, there are also innovation led by Prof. Jemima, where she developed a teleglaucoma program, and this I think has been patented, where we are the patient making sure that patient does not miss their appointment and follow up so that the doctors can monitor the patient well and reduce unfavorable or complication from not treating or not being monitored in terms of the follow-up and treatment. And the other one is glaucoma virtual clinic, and this is also led by Prof. Jemima. So basically, these are the telemedicine product that we have produced in our department. So many of the research grants for us to be able to perform or carry out our activities, we need research grants, as we know. So we are helped very much by the faculty funding, and at the moment we also have lecturers who have also received research university grants, and Ministry of Higher Education we have lecturers with FRGS grants, and Ministry of Science and Technology we have received science fund in terms of making sure that our product or innovation goes further. Okay? So in terms of industry, we are working very closely with industry, where we have all the investors, and I won't say investors, I would say sponsors. Yeah. So these research grants are being granted by all this industry to ensure that to support this research activities, and also to further enhance the output of our research. So we are very grateful to all the research industry that is willing to collaborate with us. So far, the track record has been good, and we are gaining trust. And now I think we have more and more industry who are interested to do research studies with us. So we have attained many MOU, MOA, and research agreement, and Indonesia is also one of our counterpart, and we also have RANSCO in Australia and New Zealand Ophthalmology Society to be in our MOU. So publications wise, we have increased our publication for the past 5 years, and I would be proud to say that our team has always attained the KPI set by the faculty. So publications in high impact journals are now coming more and more. And we also, as I said, we have national linkages with many local institutions and bodies. And we also have international linkages, as I mentioned just now. And industrial linkages as displayed here. So I just want to first touch in a little bit about our key research leaders. So Prof. Maylene is one of our key research leaders with interest in retina, stem cell, and tissue engineering, insulin eye drop, and ocular surface wound healing studies. You can know more about her by scanning the UKM Sarjana, and you can look at her research activities and achievement. So type UKM Sarjana and Professor Maylene, and you will see her many projects at the moment. So Professor Jemima is also one of our key leader with research interest of health services, outcome in research in glaucoma and diabetic retinopathy, and also Internet of Things. And Prof. Shamsia is very much into management of secondary glaucoma and glaucoma imaging, and I think she's also into biomechanics study for inpatient with glaucoma. So me as one of the researcher in the team is very much into cornea transplant, corneal and limbal stem cell regeneration, corneal biomechanics, diabetic retinopathy clinical studies, cornea donation awareness and education, plus any visual science studies. So, and Prof. Safina is also into our research group, where her research interest is in childhood eye diseases, children health advocacy, education, and I believe myopia. Okay, so these are the future plans where we want to make sure that we upscale our production and marketing of our innovative products, and we would like to collaborate more with the industry and international research body. Okay, should you be interested to contact us with about any research collaboration or a cooperation, please do email me at this email. Thank you.
Okay, thank you, Professor Dr. Wan Haslina,
Thank you.
for the presentation. Okay, so we shall proceed our symposium to the next group. Next group is the sorry.